I serve as the chief clinical officer for Guardian Recovery. We do treatment in different states. We serve thousands of people a year, and we have medical detoxes that we start with. So if somebody needs to be detoxed from alcohol or drugs, they're going to come in. We're not going to start asking questions about what the underlying stressor is. We're going to first do medical assessments, nursing assessments. Sometimes we have to send them to the ER if they're in dire need or they're so acute that they can't even be in the facility that we have. We're going to just get them physically stabilized, and as we're getting them physically stabilized, the thing with addiction is a lot of people just say stop. But for people that just stop, and assuming they're not in danger, like in alcohol, if you just stop, you can have seizures and die. Other drugs, if you just stop, it can be extremely uncomfortable. But even if they went to a detox and were able to stop, their life doesn't generally get better right away. In fact, a lot of times it gets worse. Now, maybe it's better in the fact that they're not about to die. They don't have these physical symptoms, but emotionally, they've been using this substance or this or alcohol as a medicator. Now all of a sudden the medicine's gone, and they've got to deal with life. And so they can actually feel a lot worse right when they come in. So first what we're going to do is really understand what's going on with them biologically so that we can make sure they're safe. And then as we can support them over the days that they start, becoming a little more comfortable, their physical conditions start to stabilize, then we can start to really understand what's going on with them and their environment. What is their pattern of use? When do they use? What are the effects that it's having in their life? Because we want to understand how it's playing out everywhere. Like I said, biologically, psychologically, and socially, and really get a clear picture of who this person is. And sometimes people come in more motivated than others. Sometimes they get brought to us, like you said, and I've seen it work either way. That someone who's comes in and says, "I need help," I'm willing to do anything. That they end up not following through with their treatment, and other people that come in fighting and screaming end up, doing very well over time. I actually like it when people come in that kind of struggle.